everyone. Welcome to Surviving a MIPS Audit, presented today by Christy Brantley, myself, and Heather Miller. You'll hear from Heather a little bit later on in the webinar. We are both professional services consultants here at Nextech. Who are we? The professional consultants team offers more than 50 years of combined experience in practice management, industry consulting, marketing, and MIPS regulatory management. Heather and I ourselves are MIPS consultants here at Nextech, and we assist Nextech clients with MIPS strategy in achieving maximum points for their annual MIPS reporting. Don't worry, because we will be answering questions at the end of the webinar, so please feel free to type your questions in the GoToWebinar control panel at any time during the webinar. Also, all attendees will receive a recorded version of the webinar upon completion. Before we start the webinar of Surviving a MIPS Audit, we're going to first review a few regulatory updates. 2019 MIPS scores have been released as of yesterday. You can access this by logging into the QPP website and go to your 2019 feedback reports. This will now include your final score as well as your payment adjustment that will take effect in 2022. You will have a 60-day window to submit a targeted review should your numbers not be correct. So that will give you until October 5th to submit your targeted review. CMS has also created a COVID-19 hardship application. With this, it will reweight your MIPS category. You can file for a hardship application if you would like. This is a great option if you feel you were not able to accurately collect data during COVID-19. The extreme and uncontrollable circumstance application is open through December 31st of 2020. To do this, you would need to log in to the QPP website, go to About, and then COVID-19 response. There you will find the application. You can reweight quality to PI. That will make PI 70% of your score. But if you are approved and then you choose to report at attestation, it will override the approved application. There is a great fact sheet regarding this process on the QPP website. You can go and check it out. Audits resumed August 3rd of 2020. Starting this week, CMS is resuming suspended medical reviews and starting the initiation of new audits. These will continue regardless of any change to the status of the public health emergency. Today's presentation is going to provide you a great game plan to ensure you will be prepared should you be selected for an audit. Last but not least, release of 2021 proposed rule. You have 60-day comment period, which will be closed in October, and then the final rule should be released in November of 2020. So be on the lookout for future webinars highlighting these changes. So let's get into our webinar, Surviving a MIPS Audit. We're going to discuss three things today: audit basics, documentation due diligence, and audit notification. Audit basics. So there's three things for audit basics. Maintain all documents with provider and practice details, including NPIs, CMS certification numbers, clinical name, practice name, and annual MIPS eligibility from the QPP website. So take screenshots of the provider's eligibility twice a year from the QPP website under MIPS and click on the Check Participation Status link. From there, you'll be able to add your provider's NPI and take a screenshot of their eligibility. Retain time-stamped copies, full-page screenshots of successful registrations and submissions, pertinent communication with CMS, including the date and time from the computer. Sample slide will be provided to ensure you capture all data later in the webinar. And then you need to make sure you complete your annual security risk analysis, or SRA, documentation requirements, initial assessment, identifying gaps or areas of improvement, and document efforts to correct deficiencies. 33% of failed audits are due to not having an acceptable security risk analysis. This is what the auditors are going to ask for first, as this is the #1 reason for most practices to fail an audit. Since this is a yes or no answer at attestation, most practices say yes, and it was never completed, or the SRA has been completed, but nothing done to correct the deficiencies throughout the year. Remember, the security risk analysis is not just a MIPS requirement. This is a HIPAA requirement also. If you need help doing your security risk analysis, there are partners that Nextech works with that can help you not only with the SRA, but with your annual recertification of HIPAA. If you need more information regarding these partners, please reach out to your Nextech representative to get more information. Here is the example screenshot of when you are taking your documentation and storing it. Make sure you take your screenshot along with the date and time stamp so that you have when it was done. Monthly MIPS overview. Generate quality measure reports monthly to track progress of each measure and compare to MIPS 2020 benchmarks. For this, you are ensuring that your quality data that is submitted to CMS is valid and correct. So we recommend that you run monthly MIPS reports to make sure your data is correct. We'll dive in a little bit to benchmarking. Each quality measure has a unique benchmark and are changed each year. Based on your provider/group performance of the measure, you could score from 3 to 10 points per measure, unless the measure is capped or has no benchmark, which then you will have 3 or 7 as your max score. If you can see from the slideshow, the documentation here, the score is 89.47, so you can see you're getting 6 points on this, 3, 4, 5, and 6. Again, make sure you do a monthly random sample validation test, 5 to 10 patients per measure from the met and the not met list to make sure that the information that is either pulling to the registry or on your QRDA3 reports are accurate. You also want to hold monthly MIPS staff meetings to address audit gaps and identify a plan of action. Once you've held those meetings, document all meeting notes so that you can put what you're doing to address your gaps that was identified. Maintain and validate all procedures and policies as updated throughout the year. We all have policies and procedure manuals. We just need to make sure that those are verified a couple of times a year and document it that it was done. If you update a policy, put the policy date that it was updated and add it to your policy book at that time. Planning for success. Plan ahead. Know and understand what the required documentation is for each of the MIPS categories as outlined by CMS. You can find these on the QPP website. Save your documents. Retain documentation for each MIPS category and validate data that was reported at attestation to CMS. Make sure you have your screenshots with the date and time stamped from your EMR, and you can do that by using a snipping tool. Also, conduct a mock audit. Develop a tactic for audit notification receipt ensure your audit response process is fully loaded, and use the lessons learned from the mock internal audit to refine your process. Now I'm going to turn the webinar over to Heather Miller, and she's going to discuss documentation due diligence.
Thanks, Christy, and hello to everybody. And joining us today for our presentation on surviving a MIPS audit. So drilling into some documentation due diligence. Proof of documentation is going to be the key to success in you passing your audits. And we are going to walk through each of the categories of MIPS and discuss what documentation you will need to be preparing and putting into your audit e-files. So starting with the quality measure category, supporting documentation for all of the quality measures that you submitted to CMS or via a third-party intermediary should be retained. Retaining a report for each of the quality measures that were submitted showing the numerator and denominators based on the submission methods you used. So if you did direct EHR reporting, you would be able to present or produce the QRDA3 reports, print them to PDF versions, and then maintain them within your audit files should you need to prove, again, the numbers that were submitted. If you do a third-party registry, you can maintain screenshots of percentages on dashboards, but you also will always be able to reach out to your vendors, and then they would be required to provide you any of their, basically the information that was submitted on their side, and ensure that they assist you with that validation process and getting you those inputs that they provided to CMS from the registry databases. So it is important to remember also that MIPS requires all payer data. This is not just your Medicare patients. It should be all patients that were billed out to any payer included in your numerator and denominator reports for 70% of your required visits during the year. And that's your data completeness side of this. So you want to be sure that you've got at least 70% of the total eligible visits for all payers within these reports. Moving on to promoting interoperability. This is going to be the category for the exchange of electronic data from within your 2015 certified electronic health record. Retaining documentation here would be a time-stamped screenshot of the numerator and denominators for each of the 4 promoting interoperability measures as you submitted it to CMS for your attestation. This timestamp needs to fall within the 90-day reporting period that you submitted with attestation. So different from quality. Quality, we report for a full 12-month period. You have the option in the promoting interoperability to choose a shorter 90-day period, and we want to make sure that that time-stamped screenshot falls within that 90-day reporting period because they're going to look to see that that matches. You also can do PDF summaries of the full reports if you feel or your EMR will allow you to produce that type of record. They might be a little bit longer as they probably include patient information, and you'd want to right-click and print those to PDF to just save it should you need to provide them any type of patient detail. Moving on to improvement activities. This is going to be an area in which you attest yes or no that you've completed the activity, and in 2020 that needs to be for 50% of your reporting providers. So to retain the documentation used to validate the activities, these are what you're going to need to do to demonstrate that you did consist and meaningfully engage in this activity for the time period that you reported to. Again, improvement activities is going to be 90 days. We're going to make sure that if any of the documentation we provide needs to be timestamped within that 90-day time period that you attested the activity occurred. Now, CMS does provide recommend documentation for the improvement activity category, and you would want to get out and access that. And we're going to show you where to go in just a few minutes. One of the ways that you can clearly show your improvement activities is creating a policy and a procedure file that will clearly explain how you are implementing this activity within your practice. This is a short sample of how these policies can look. the date range in which you produced them or you participated in them, and then you can outline that measure description. So here's an example of the 24/7. We've got the description that is provided by CMS. We've got general instructions and responsibilities, and these can be drilled all the way down into your workflow. Who is responsible to make sure this happens, and assign it to staff or staff roles within that policy. And then you can add in that supporting documentation that CMS states you need to have in place should you be audited and then want to prove that the activities did occur. Because remember, you're only attesting a yes or a no. You're not having to really put in any numbers. So this clear outlining documentation will be supportive to the fact that you did the activity. And reminding too, for 2020, it's not just for a one-time. If you have multiple providers, you need to demonstrate it for 50% of those providers participated in the activities in which you guys have attested to. So let's talk about where do I find this information. The good news about CMS is that they have gotten very good about the resource library and giving you access to data as you can easily find it. So if you go in here, I'm going to actually try to get out to the website. Let's see if it will connect us. And once you're on the TPP website, if you go over to the About section and you go under the resource library, this is where you'll come down to a search box and you can enter in the word audit and return. From here, you're going to get a file for the MIPS Data Validation and Audit Overview. You will click on this and it will download the PDF questionnaire of all of the key points in regards to auditing. For right now, the only two performance years they're performing audits on are 2017 and 2018. If you pan down to the end of this, you're going to see the validation criteria for both the year 17 and 18. So you need to be very keen on which year you're preparing for, because these can change and you want to make sure you're working from the most recent or correct year information. To view the validation criteria, when you click on this, it's going to provide you a zipped audit file, and it's almost like a toolkit. So this toolkit is going to provide you a variety of different information, fact sheets, changes, criteria, and at the very end is an Excel document with validation criteria. When you open this Excel document, you will be able to drill in to all of the variety of categories of improvement activities. There's over 100 of them. And each activity, so here's our 24/7 that we discussed previous of a description. And in this column here will be the validation documentation that you would need to create and have on file to prove that you completed these activities. So within our screenshot, you will see we kind of walk you through this process and how to get to and drill all the way in to the validation criteria that you want to make sure you've, again, produced for 50% of those providers participating in the activities that you attested to. Last component is creating an audit e-file. This is where you're going to store all of the documentation in a common place, and this is going to be for a minimum of 6 years per reporting period, and that's to be in accordance with the False Claims Act. This is something that was finalized in the 2018 final rule, that they can request records or data retained for MIPS purposes for up to 6 years. And this federal regulation mandates that compliance and sharing these data requests, and particularly if you don't provide the requested information, may result in further action by CMS, including possible for future audits. So to ensure you don't get into those situations, create that e-file per MIPS reporting year. So you should have a file for 17, 18, 19 onward for each of the different components that you attested to. Also ensure that multiple people have access to this file, know where it's located, and what needs to be obtained. If you have one person doing this and all of a sudden that one person's gone and you get an audit request, who's going to know what to do and where to go and where to find it? So you want to make sure you have more than one person assigned to knowing at least where the file is and what needs to be included in it. And the last thing is make sure this file is stored in an encrypted location. A lot of this information will have patient or private health information that needs to be protected per HIPAA guidelines. So you want to make sure if you are keeping it in an e-file or even if it's in paper, you've got it in a format in which it's following the HIPAA security privacy guidelines. So now let's go on to our third section of our Surviving a MIPS audit today. It's an audit notification. So how will you know if and when you've been selected for an audit? So CMS announced that the MIPS data validation and audit process would begin in the June of 2019. With the public health emergency situation, we did receive a pause on that. And as Christy stated earlier, this has now been turned back on and we could see audits coming back into play. Typical timeline was initial requests were sent out certified mail in June or July. Due to us being in the public health emergency, this probably is being pushed out to come in now August, September, October, and be on the lookout is pretty much what we're trying to keep you on guard for. When you receive your certified mail, you have 45 days to respond from the letter, from the date the letter is written. So even though you received it this date, you want to go back and make sure you look at the letter date and put that 45 days on the calendar to ensure you provide response. Now, how do you get selected for this? Data validation and audit letters go out mailed by Guidehouse. Guidehouse is the contracted company that was awarded this ability to do the audits through the government. And MIPS is a lot more complicated than meaningful use, and the stakes are much higher. So as we saw through the MU audits, documentation is going to be key to your successful outcomes and making sure you have, again, that audit book ready for whenever you might receive one of these letters. Selection includes either, again, the 2 performance years of 17 or 18, and MIPS participants are randomly selected. So it's not like you really are, it's just completely random. And we have documented that 25% of attesting providers will be audited. So if you guys aren't, you might know somebody that ends up getting it, but it's 25% of the total. Now, a notification of an audit. So just to show you an example of what, if I'm audited, are they going to ask for me? What is it going to look like? So this is a quick example of an audit regarding a promoting interoperability measure for prescribing and ERX and patient access. You'll see quickly there's our 45 days of receipt, and it's going to outline very clearly for you what they want you to send back to them to prove again that this was completed. Providing a copy of your certified health IT product list. So this is something you can get from your EMR vendor of the certification that they are 2015 certified, particularly for promoting interoperability. It's a requirement to even report the measure. Then for one patient, provide evidence of the following: a medical record documenting that the patient was seen during the reporting period. Remember, 90 days. We want to make sure that within the 90 days, that is when you pick the visit. Documentation, such as dated report, screenshot, same thing we said earlier, that a permissible prescription was queried for a drug formulary and written and submitted through e-prescribing during the reporting period. So making sure you have these specific documents in play makes this process, when you get that letter, as simple as it can be. You're confident, you know you've got the information, and they actually really outline it pretty clearly what they want back from you. So again, with your notification of your audit, you will receive a point of contact from Guidehouse that is going to be identified at the letter, and use them for questions. Don't just assume. Make sure you ask the questions. Make sure you clearly understand what's being requested. Don't send more and don't send less. They are going to completely outline for you exactly what you need to send. So if you have any type of clarification or confusion there, just make sure you go ahead and get that clarified with the point of contact that you were provided by them. Keep a record of everything you submit. So once you've done the submission of your information, the screenshots, everything, keep a copy and a record of that. Should they say they didn't get it, You want to make sure you've got the email, or if it's certified, on the date you send it, because again, you've got that 45-day window to make sure they receive a response. Within getting the response, CMS will notify you of their decision within 30 days of your submission of the information they've requested from you. And next, what is the potential impact? And in all regards, what's the potential financial impact? So CMS may reopen and revise a MIPS payment adjustment as a result of this data validation or auditing process. So the biggest thing that can happen to you is if you receive payment adjustments to the positive and then you're audited and you don't pass, they're going to come and remove those positive payment adjustments in one lump sum and take them back based on not passing or providing them proper validation of the information you submitted to them. So it is most important, you do not want to get these financial pulls back from any revenue or potential payment adjustments that you received with MIPS. And that's why this process is very, very important, because that's why they put it in place. It is designed also to be educational and to confirm that MIPS participants are understanding measures. They are also designed to confirm that we've complied with the selected measures, but overall, they're making sure that what you attested to and what you put out there is correct. So in regards to appealing your audit, so should you, let's say, not pass an audit, in meaningful use days, they had an appeal process. And we are such in the infancy stage of audits for MIPS that there's not a clearly outlined appeal process that we could find. So once we get that information, or it's been released by CMS and we see kind of how that's going to go, we'll do some follow-ups to this webinar to provide you that information. So a couple reminders, let's just go back to some of those new regulatory things that are out there, is review those 19 MIPS scores. They're out there now, they are final. There's a short time frame for you to submit a targeted review should you think there is an error in that final score report. So you might have seen your preliminary scores, go back out, these are the final scores. If you do not get that targeted review in, that is the impact you're gonna see and the score that's gonna be promoted out on Physician Compare and be assigned to the providers in your practices. They also have released the payment adjustments. If you did get a positive payment adjustment, you will now be able to see what that adjustment is in these final MIPS scores that's been released. Some exciting news there. They're actually pretty decent percentages. We thought with COVID-19 being reweighted to an automatic no penalty that it would impact that, but pleasantly surprised with those numbers. So check those out as soon as you can to confirm, and again, submit targeted reviews if needed. Also, those hardship applications for the extreme and uncontrollable circumstances for 2020. It's out there. You can definitely submit those, get those approved if you feel that you were impacted by COVID, or again, any other hardship that potentially applied to your practice. And then the exciting news of the 2021 proposed rule release literally came out yesterday, so we're on top of it, and we're going to be rolling out some webinars to give you some guidance on what to expect for MIPS in 2021. Last and I guess the most important, if you guys need help, we have a way you can contact Nextech and get more information on the MIPS consulting program. Christy and I would be happy to share a little bit more on how we manage those accounts and keep everybody with a very strong strategy for success with MIPS. So based on that, we can move into questions, and I'm just trying to maximize my screen to see what I've got here.
I did have, Heather, a few questions that have come in.
Okay,
one of the questions is there a hard copy of this presentation?
There will be a recorded version sent out to everybody that has enrolled and registered. That is the way Nextech will release this information. So you'll have a recorded version of the slide presentation.
Another question, Heather, was what suggestions would you offer someone who has been newly assigned to managing MIPS audit procedures at a clinic who has been recently hired and may not know any data from the 2017 and 2018 year submissions?
That's a very good question. All of the softwares certified through the entity will have the means to produce reports from previous years with the specifications of the meaningful use. So some of this, it obviously changes year to year. If you have no means to find anything and there was not an audit book created, I would do your best to recreate that information into an e-file for the 2 different years. You will have the capacity to go backwards and still produce reports for the years. Time stamping obviously might be a little bit more difficult. You might have to drill into a note back from one of those date ranges from which you reported in. Might be a little bit of work, but I would recommend getting on it, or at least having some type of documentation that would state why you don't have it. If it's an employee left, didn't manage it, but at the end of the game, it's going to come back to the practice. So I would do whatever you can do to reproduce data and then get it into the e-file according to the year 17 and 18.
Another question was, what if the past 2 years you were part of an ACO? We are submitting a sole practice now 2019 on.
So you would only be responsible for your submissions as individuals. The ACO would have to be audited. That's an aggregated score for everybody participating. So your responsibilities there, I don't believe you would have. Now, most ACOs might have you providing them the promoting interoperability measures. So if that's the case with your ACO, I would keep that information in your audit file. I know that the quality data is aggregated on the ACO side, so you might not have any of that information because they choose the quality measures, versus when you report individually, you're choosing your quality data and submitting it. So for PI and ACO, I would keep that in your audit book, or anything else that the ACO required you to submit. That's what I would maintain there. Moving forward, you're going to need to now do the full audit file.
Another question was, can you send the sample policy, which the sample policy is in the webinar that you have?
Yes, you can replicate that format. There's templates out there. The data, again, is in that validation criteria spreadsheet, the Excel document. It'll give you the descriptions. It'll give you the validation. It'll even give you the roles and responsibilities. And then you can fine tune it to your practice. So you really don't want to cookie cutter it too much, because the policy really should flow with your practice workflow, and then again assign out to the roles that you are going to have managing it. And then it also will include the time frame in which that activity was performed within your practice.
Another one that we had, Heather, was, are you seeing audits only on the positive or negative adjustments, or are you seeing audits on the neutral adjustments too?
Of the audits I've participated in, all of mine have been those that had positive adjustments. I don't know if that's coincidence or if that's just where my experience has been. So if it's a random draw, I don't think that that's relevant. Now, when they say random, what's random? But if it's random, it should come from all sides. But the ones that I have done and completed, they were all ones that had positive adjustments.
That right now is all the questions that I noticed, Heather.
Yep, I'm looking through them too. And if you all have further questions, we'll make sure to get our contact information included in the information that comes out with the recorded version. And Christy and I would always be available to help you out as you have questions. Getting these e-files together like I said, it's a little legwork, but once it's done and you get that letter or notification of an audit, you're going to feel completely confident that you know and you can go grab what you need. And it's pretty simple. They don't ask for too much. Like you saw in that example, it's one patient. It's not like 15 patients. It's one patient, one date, and then you'll get through these audits pretty successfully.
And the most important thing for the audit is documentation. Make sure for when you're attesting, what you're attesting for, you have that documentation. That way you're not going back scrambling to find what they're asking for. You'll have it really nice and neatly in your MIPS audit folder, and you'll be able to pull it out. And again, like we went back, make sure multiple people have access to it, so that if they are no longer with the practice, you'll know where to go to find your information.
Correct. And we did just have 2 more questions come in. One, I know this is more on your plate. I agree, it's, you know, unfortunate, but if we get a good process in place and you do the screenshots as you produce the report, just make it part of your task list when you're getting the data gathered that you know you need. So you're not going backwards. You're just doing it when you get that attestation information together. Grab those shots and make it part of your workflow. Would there be any reason not to fill out the hardship application? Good question. Honestly, if you, I don't see anything wrong with it, because at the end of the game, if you choose to report, it will trump the hardship. Obviously, you want to be valid in why you submitted the hardship, because they might approve it, but if they came back and audited your reason, you need to be able to support it. So if you felt like during COVID you had an inability to collect accurate data, why is that? Make sure you document and can show this is the inconsistencies as to why my data might not be valid because we were in this public health emergency. So there is a cheat sheet out on the QPP website. If you go right on the very top, there's a headline and it says COVID response. And if you click on the COVID response and drill in, there's a really good Q&A or fact sheet on the hardship application that will explain to you how and why they're approving, how and why and what you need to have in place. Very, very much a tool. And that kind of leads into the next question, which is, what is the best way to educate yourself if you're new to MIPS? And the QPP website, where I went out earlier and showed you where to drill into their resource library to get to the audit materials, there is a slew of other resources there for each of the different categories. Tip sheets, I think there's videos. Also at Nextech, we've got some variety of regulatory webinars that you could tap into from previous presentations, just on overview. So there's plenty of resources out there, and the QPP website, I've actually been really proud of it. It's much easier than when everything was on the Medicare website. It was very hard to navigate, where they've really made it easy to search through measures, search through the categories, and get as much knowledge as you can about MIPS, particularly if you're new to it. All right, I've got one more question regarding the patient example. Does that mean we should pull info for all of the patients listed within the reports we have for MIPS, or is it just that we can go to those reports and select a patient and then reprint items specifically? Typically, that's what you'd be able to do, is go back to a patient within the time reporting period, go to like the ERX and show that a script was produced and time-stamped using your ERX system. So you should be able to go back, because you don't need to do it for every single, or you could go ahead and pull a patient for each measure and go ahead and put it in your audit book, but I would wait to see what they want. I don't know, Christy, if you agree with that, but that's kind of how I'd handle that.
Yes, absolutely.
And we'll put together an answer sheet to these questions. I know you might be trying to take notes, but we'll do a follow-up for all the questions submitted, and maybe do a little more research and confirm that that's the best solution, and get a little more formal response for you guys for the questions you guys submitted. And Christy, do you have anything you need to add? I don't see any more questions coming in.
Nope, that looks like it.
And be on the lookout for some new webinars for 2021, some follow-up if we get any more information on the appeal process based on the audits coming back alive after the release of the public health emergency stuff. So
thank you for joining the webinar. And hopefully it was very informative, and look for more coming in the future.
Thank you guys very much for attending.